So we're going to give you 60 seconds each to run through yourself, who you are, a little bit about your company and opportunity. And again, maybe your superpower if you want to do that.
My name is Leon Anajar. I'm the Chief Medical Officer and co-founder of Flagler Health. We do a lot, but our marquee product is an AI operating system for musculoskeletal clinics that automatically triages patients to the right provider and then monitors the patient's health after they leave the office. We started in 2022. We're currently in 21 states. We work with thousands of providers, and we've helped treat a little over 10,000 patients at this point. We're super excited to be included in this and look forward to the discussion.
Summarize the key message that you would tell in this very short period of time you have of your clinical and economic value propositions, and make sure you tell us if you're reimbursed or if you're just, an enterprise sale that's going to just fit into the overall economics, and explain that business model. So it's really ultimately business model that we're kind of going after here, as well as the benefits.
Yeah, so I totally agree with the statement that you made, Paul, that unless you are providing significant value and also able to drive revenue to the practice and have incentives aligned, no one's really going to adopt your tool. We firmly believe that if you don't make it unbelievably easy for doctors, providers, hospitals, whoever's using your product to use it, they will not use it. And if you don't make it so that there's some key incentive for them to do it, they will also not do it. So it can be very easy, but doesn't generate any revenue, they're not going to do it. And it can be very hard, but if it generates a ton of revenue, they might do it, right? So what we decided to do was lean into that. We say it's beneficial to identify patients for advanced procedures, so we do that. And then to monitor these patients, there are billable CPT codes. So there's remote therapeutic monitoring codes and chronic care management codes. So we directly engage with the patients, do all the compliance, generate the note, put it all up in their EHR. All they do is give us access to an API with their electronic health record with Athena or ECW or whatever. We start generating the recommendations. We start interacting with the patient. They bill, they collect, and then we take a portion of that on the back end. So they are perfectly incentivized to have us in their practice. We generate significant revenue for them so that they want to continue using us. And as an anecdote to show that we're providing significant value to them and the patients, we've had at least 5 instances where when we were on the phone monitoring a patient, they were actively having an MI or a stroke. They were reporting active chest pain, pain going into their arm, slurred speech, dizziness. In all 5 of those instances, we called 911 on the patient's behalf. 911 arrived to the patient's home. In 2 of those instances, the patient was found down on the floor, passed out. They got taken to the hospital, evaluated, treated, and significantly better. And in one of those 2, the reason that they passed out was because they live in Arizona. It was so hot and they didn't have an air conditioning. So we actually flagged the team to see if we could get them an air conditioner, and the practice actually bought them one for $100. So we're providing value and make it easy. We have incentives aligned, and the patients love it. So that's how we get into practices.